I was talking, I didn't realize my mic was muted. Hey, everybody, happy Monday. Welcome, welcome, welcome. I want to make sure y'all can hear me because we had that one mishap a couple Mondays ago. So, everybody, type one in the comments if you can hear me, and two if you can see me. And then I'm going to check LinkedIn just to make sure we don't have any issues, since that was a platform that I did not show up on. But yes, type one if you can hear me, two if you can see me. Okay. Yep, it looks like I'm on. So hey everybody, welcome. Thank you so much for joining me. Another aspiring CRA Q and A. I try to do these on Mondays at 7 p.m. Eastern Standard Time. So thank you for joining. And for those of you who are familiar with the process, and let me see. Oops. Oops. I think it's okay.
All right, this is how you
Oh no. I'm trying to make sure it's
upload
on
a
LinkedIn too.
carousel on LinkedIn.
It does not want me to show up. Okay. Okay. I see it now. One and two. Okay. Thank you. I think your name is pronounced Yamisi. If I'm saying it wrong, let me know. But thank you so much for letting me know that you can hear me. Perfect. So welcome everybody, and like I was saying, I do these Q&As. I try to do them Mondays at 7 p.m. Eastern Standard Time. And for the month of November, I have been covering a different aspiring CRA problem every single day. Today is day 28. So I want to get started today by talking about problem number 28 before we go into the questions. Okay, perfect. I said your name right. And if you have any questions while I'm going through today's problem, if you have any questions, drop them in the comments. My goal now, I tried before, I was trying to keep the running list and it got so long and so far behind. So I want to try to keep at least answer all the questions that are in each live in real time instead of having to keep going, with that rollover list. So if you have any questions that you have about landing your first CRA job, any challenges that you've been facing, any struggles that you've had, or if you're just getting started and you don't even know what struggles and challenges you might encounter, put all of the questions that you have in the comments. So, before we get into the questions today, I want to hop over and discuss problem number 28. Like I said, I've been doing the 30 over 30 series for November, and we're on problem number 28. So, another problem that I see, a common problem that a lot of people, that clinical research professionals who want to transition into the CRA role experience, is that they think they need a science, healthcare, or clinical research degree. And that's not the case, y'all. You don't. When they say degree required, if you look in the on the job description in the required section, it might say science, healthcare, life science, clinical research. It might say those things preferred, but it is not an absolute requirement. All you truly need to be qualified and a competitive candidate is a bachelor's degree. And for all you clinical research professionals, all my CRPs who already have experience as a clinical trial assistant coordinator, regulatory coordinator, what have you, all of my CRPs, you already have experience. So you certainly are more than qualified if you have that experience plus the bachelor's level degree. Now, a lot of people, they'll come to me and they'll say, well, I have a degree in history, or I have a degree in English or communication, something that's not science, healthcare, clinical research, right? And so they're thinking about going back to school to get a degree in a science, a healthcare, or clinical research just because they think that will make them more qualified or make them a better candidate. And that's not actually true, y'all. For clinical research professionals specifically, once you already have the industry experience, you have what you need. their experience is gonna typically outweigh or trump the degree, an additional degree that is, or a high level degree. It's gonna trump it if you already have that experience. So don't worry about trying to get another degree in biology or get a degree in clinical research if you already have a bachelor's level degree and you're already a clinical research professional with some experience. You don't need to go back and get another degree, a science, healthcare, or clinical research degree. You're right where you need to be. So I wanted to cover that today. That's problem number 28. And if you have missed any of the if you've missed the last several days, the last several days for November, so days 21 through 27, then it's perfectly fine. The recordings are still up, so you can check it out on LinkedIn, YouTube, at Jasmyn Adams, Aspiring CRA TV, and then over on Facebook, and that is the CRA Solution. You can check it out. So let me see. Let me get into the questions. And again, drop all of your questions in the chat, in the comments. So let me go to my running list. So this one came from Keisha a little while back. And one of her questions was, what skills or college degree is needed to become a CRA? So skills, I actually talk about that in a podcast episode, which I will drop in the chat, the comments once we get off. And I believe I said the same thing came up yesterday when I was live. So I'll drop that in the comments. And if I forget, feel free to remind me. But I did an episode of that on my podcast, Confessions of a CRA, where I talk about all of the CRA gateway skills that recruiters, companies will be looking for in entry-level CRAs. So I'll drop that and you can hear all about them. I've outlined them. I've broken them up into 10 categories. In terms of degree, we kind of just went over that with problem number 28. And that if you're starting out, let's say you're in high school or you're going back, you're not going back, but you're just getting started. Let's say you've been working and you're just getting started in terms of getting a degree, then yes, by all means, it's preferred for you to get a clinical research or science type of degree if you're just getting started. What I mentioned with the problem 28 was for people that already have a degree. You don't need to get another degree. You're fine right where you are. But if you're going to get a degree and this is going to be your first degree, then preferably choose a science, clinical research, or healthcare. Clinical research will ultimately be the best, but keeping in mind that it's going to be a very, very, very specific degree, and it's not as common amongst universities as, let's say, a bachelor's in biology is. So you'll be a little bit more limited in terms of the universities that you can pick. And then also, if you, for whatever reason, decide not to go into the clinical research space, it may potentially limit you other opportunities outside, potentially. I still say it's a good degree though. And then another question from the same person: if you don't have a degree, is there a way to become a CRA with a training program? So is there a way? Yes. I'm not going to say that 100% no. Yes. I always say where there's a will, there's a way. And if you put your mind to something, you can absolutely accomplish anything. But it does make life a little bit harder and a little bit more challenging if you don't have a degree and you don't have experience and you're trying to enter the field with no degree, no experience, and all through a training program. Because a CRA, and this is another kind of good point that I want to bring up, is that her question was, is there a way to become a CRA with a training program? So there's training programs where you pay to be in, that is offered through a, private, company, training type of company. And they typically will offer a certificate at the end. They may offer multiple days or weeks or even months of training. They might have an internship at the end, and then you'll get a certificate of completion. And that's not with a company per se, like a drug company, a pharma company, a device company, a CRO. And then there's training programs, which are actually entry-level CRA jobs where companies have training programs. But at the same time, they are entry-level CRA jobs, and you actually get paid for these positions, because again, they're training you. It's technically a training program, but it's still a job. So you have to be careful when you look at training programs, so to speak, and which ones are you trying to be a part of. So obviously the ones that companies are offering where you get paid, that's the CRA job. So if you're in that, then you've made it, you have your job. But the other way, where they're quote unquote training you to be a CRA, and you may or may not get that internship, and they're going through, the technicalities, the hard skills of what it takes to be a monitor, how to monitor, things like that, then that's a different story. And there are some people that have made it that way. But I always say that oftentimes it's just easier just to get a degree than it is to try to go that route, in terms of the time and energy and effort that it takes. And then another question, what would be the next level up from a CRA? So there's different levels in the CRA role. So you have CRA 1, CRA 2, CRA 3, depending on the company. It might just go from 2 to senior. And then some companies have senior 1, senior 2. There's principal CRAs. I know some companies now have executive CRAs. So there's levels within the CRA role itself that you can always climb. And then outside of that, it's going to be up to you. You can go the project management route, you can go the clinical trial manager route, or you can go the line management route. Some people decide to get out of ClinOps altogether, and then they might hop over into pharmacovigilance or data management, or regulatory, for example. So the sky's really the limit in terms of where you want to go, and where you want to take your career. Once you have the CRA role, I always say it's kind of like the gateway role to all the other roles in the industry. And then I will add, I did leave out the in-house CRA position. So I've been getting this, I get this question. I've gotten it a lot, but especially lately, I get it more often, is that people want to be a CRA and they want to climb, but they don't want to travel at that road warrior rate anyways. They don't want to travel at that 80%, that 60 to 80%. They don't mind the travel, but not the 60 to 80%. And I get that, because I've done it and it's been rough. So there is the in-house CRA route, and you can become an in-house CRA, and you can have the same successful career as a regional traveling CRA. So that's another option too. And there's levels, typically there's levels for each company within the in-house CRA role. So there might be in-house CRA 1, 2, and senior. And then you can branch out the same way as you would with a regional traveling CRA role, where you could transition into trial management, for example. So that's another pathway too, the in-house CRA route, if you don't want to deal with all that traveling. And then I also have a podcast with Mary Williams, a podcast interview episode with her, and she did just that. So check that out if you're one of those people that's interested in the in-house CRA route. And then another question is, my only question would be how to get started with CRA roles. And this is from Tania. What should I do if I don't have prior monitoring experience, even though I have worked for the clinical research industry for years now? So I actually covered this as one of the problems. Let me see which day it was where I talked about you think you need monitoring experience. Day 2, I believe. Yeah, I think it was day 2 where I talked about you think you need monitoring experience in order to, and what other, there was another one where I went more in depth, I thought. Day 27. So day 2 and day 27, if you take a look at that, Tanya, then you can see that where I talk about you don't need monitoring experience specifically to land your first CRA job offer. That's kind of a myth or misconception, that you think you actually have to be a monitor. I would say that 99% of the people in the CRAs in the industry that I know anyways, my colleagues, my friends, we did not have monitoring experience before we landed our first CRA job. That's very rare that you'll get that opportunity. But what they are looking for, and what they do mean when they say experience required on these job descriptions, is that they're looking for you to have some type of the gateway skills that I talked about and I'm going to drop that podcast episode in the comments because we keep coming around full circle to these skills, but they're looking for you to have experience in the gateway skills. You don't necessarily have to have all experience in all 10 categories, but I say if you're like at least in that 50% mark and you can say you have experience in at least half of them, then you're in a good spot to be. Of course, the more the better, but you don't necessarily have to have experience in all the gateway skills that I mentioned, the CRA gateway skills. So, I hope that answers that question. And then the second part of the question, what should I do if I don't have prior monitoring experience? Even though I've worked, so if you've worked in the clinical industry for years now, and that's another, I think I covered that on day one in 30 over 30, Tanya, if you look at that. But I cover that in the 30 over 30 series where you think you need more experience or you think you don't have the right experience because you don't have monitoring experience, or you think you're never going to get that opportunity because you don't have monitoring experience. If you've been working in the clinical research space for years, you are a clinical research professional, you are a CRP, and you are qualified. So you don't need to have monitoring experience or try to get into a training program or try to do, there's a bunch of different ways out there now that I'm hearing about people that they're finding creative ways, let's use the word creative, to find ways to get experience. And you don't need any of that. You have everything that you need. If you already have that experience, that years of clinical research experience, you already have everything that you need. Trust me, all you need, if you're still struggling anyways, all you need is to learn how to brand market and sell yourself. VMS, literally, that's all you need. It can really be that simple, y'all. I know, especially for people that have been trying for a while and you've been struggling. I know you're like, whatever, Jasmyn. It's not that simple. I've been trying, but I'm trying to tell y'all it really can be if you just focus on that. And then I see Kiana has a question. Is there anything an entry-level CRA can emphasize on their resume or cover letter to stand out? I don't have any monitoring experience, but I'm trying to break into the industry. So Kiana, I would need to know a little bit more about, yes, short, quick answer to your question. Yes, there is lots of things that you can emphasize. But for you specifically, I would need to hear more about your background and your experience to be able to tell you what you need to emphasize on your resume or cover letter. But generally speaking, if you look at the JD, the job description, it'll tell you what you need to emphasize. If you look for keywords and key terms, and I covered that in the 30 over 30. I think I covered it. What day was that? I can't remember. Dang it. I think day 9. If you check that out, Kiana, day 9, I covered that about how to tailor your resume. And there was another day, I think day 10, where I talked about knowing how to use the right language. Knowing how to use the right language in your resume. So check out day 9 and 10. But I would need to hear more about your specific experience. But generally speaking, on the job descriptions, you'll see things like collecting documents, reviewing data, analyzing, things like that. So if you have a position or a role in your previous experience, if you already have clinical research experience, again, you're fine if that's you, Kiana. If not, there's still ways that you can emphasize things in non-clinical research roles as well. So if you've written reports, if you had to collect data, if you had to analyze data, and when I say data, it doesn't have to be scientific data, so to speak, but even if it's documents or information, let's say you're in the financial world and let's say you are an underwriter and you approve home mortgages or something like that, then the data would be the applicants, their documents to get approved for the home. So their paycheck stubs, for example, their W-2s, what else do you need? Proof of homeowner's insurance, all those documents that you need to submit with the application to get the loan approved for that mortgage, all that would be considered data, right? That's the data that you need to review and analyze in order to approve that particular package. So that's just an example of how you can take that information for that financial industry job and still use the clinical research language and communicate that you still have the skills that is required in order to be a CRA, because you are still familiar with pay attention to detail and reviewing and analyzing things and then making a final assessment or analysis. So that would be one way, Kiana. I hope that answered your question. But if you want to know more, then please list some details about your experience. So thank you, Kiana, for that question. And please continue to keep the questions coming. I don't see that many coming through. I do have my list that I'm going to go through a couple more. But if I don't see any more questions come through, then I can, then we'll end like right at 7:30. And I see Kiana, gotcha. Your answer is very helpful. Thank you. I will check out your previous episodes as well. Perfect. And then I also, again, I'm going to drop that podcast episode in the comments so you can hear all 10 categories of the skills that they're looking for, so that you can then figure out a way that to relay that experience. If you're coming from a different industry, you can figure out how to relay that you do have transferable skills in that particular category. So this other question, I can't see who it's from, but the question says, I currently have 3+ years of experience in clinical research industry, having worked for TMF management and transparency services. I believe I have good understanding of the basis of the industry. I'm looking to move into the CRA roles, but I'm not sure of the skills that I need to brush up on or the extra knowledge that I need to possess in order to excel as a CRA. I'm coming to you in order to seek some guidance on how I can crack the CRA interview and how to establish a foothold in all the activities that CRAs do. So this is a loaded question, but same thing. All of these questions, y'all see there's a reoccurring theme. I'm going to always kind of give you the same answer, even though there are multiple questions. So this person is saying that they already have 3 years of experience in the clinical research industry and working in TMF management. So you're good to go. The person asked about ways to crack the interview and how to establish a foothold on the CRA activities. So for your first CRA job, they're going to train you how to become a CRA. And I'm not going to ever push anybody away from extending their education and learning as much as they can about any role before jumping into it, because that's always great, right? So if you want to take an extra course or extra class so that you can learn more about the CRA job itself, great. But don't let that quote unquote gap or that whatever thing, knowledge you think you're lacking stop you from applying and starting your first role. Because if you already have 3 years of industry experience in TMF management, then you're perfectly fine. A lot of challenges that I see with the CRAs that come in that struggle are the people that don't have that TMF experience. And it's so hard. That's one of the hardest things to teach within that training period, because it's really all about you. It's so many different IRBs out there, and every site kind of keep their binders different, file differently. And then depending on what type of study it is and how long it's been ongoing, like the files can become massive, whether it's the site reg binder or the internal TMF, right? So it's really hard to train on that within a short period of time. So if you already have significant TMF experience, TMF management experience, you're already ahead of the game. Now you really only have to learn that monitoring piece, and that will kind of just come. Honestly, the only way you're truly going to be able to learn that is to be assigned to a protocol and to start monitoring and get out there. There's no class that's going to be able to really and truly prepare you for that. So if you already have the 3 years of experience, you're already ready. In terms of the interview, I covered that also in the last 30 over 30 days. I can't remember what days. Let me see. I want to say day 21, I talked about the interview a little bit. Let me see. Day 4, I talked about it. It's kind of scattered throughout. Day 5, day 4, day 5, day 21, scattered throughout. I talked about the interview, right? But the main thing that I always like to point out for interviews is that it's not about you. I think that's the biggest misconception that gets most people in trouble with the job interview. If they could just remember this one thing, that the interview is not about you, it's about the company. And it's about them trusting you to take care of their baby, which is the job. Can they trust you to take care of their baby? So you have to show them, you have to sell yourself to the company in convincing them, showing them that yes, I can not only take care of your baby, I can nurture your baby, help your baby grow, and take your baby to the next level, not just give them the basic needs, but you can take that baby to the next level, right? So the interview, if you can remember one thing about the interview, is that it's not about you. You have to really focus on providing them with the information that they need to see that you are capable, more than capable, of taking care of their baby, which is the job essentially. And then what's the next one? Of course, my computer wants to freeze up. So this person, I can't pronounce the name. I think it's Dubam. But the question is, should I include therapeutic areas in my resume, even if I have only 5 therapeutic areas of experience? And should the therapeutic areas have their own section? So I like this question because there's so much in this question that needs to be addressed. Well, first of all, the person says, I have only 5 therapeutic areas of experience. I think that's interesting how we all think that, 5 is a small number. So saying only five therapeutic areas of experience is a lot of areas. There are plenty of people who have one. There are plenty of people who have none and they're dying to get one. So saying only five is a lot. Let's start there. And so if you do have 5, you have enough to create your own section if you want to. It just depends on how your resume is set up. So the template that I use for my clients and that I always advise people to use, and if you want to take a look at it, I have it in my guide, the free guide that you can download. If you just visit my featured section, you can download it for free. But the template that I like to use, it depends on how much experience you have. If you don't have that much experience and we don't have that, like we have a lot of space to work with, then I probably wouldn't give it its own section, because we probably won't have a summary section. But if there's going to be a summary section at the top where it's basically summarizing, or career highlights, career summary section at the top, then oftentimes I'll recommend people to put it in that section, because then you can just make it a bullet and just put something like therapeutic area includes, and then list out your 5 areas. And if it's like in different phases, you can say therapeutic area phase 1 through 3 experience in the following areas, and then list it out that way. Even if it's a global study, you always want to point out those little things. If it's global, if it's observational, if it's interventional, if it's what the phases are, if it's preclinical, if it's phase 4 post approval, listing out those little things will definitely give you an edge. But it just kind of depends on your resume and how it's formatted, whether I would recommend making its own section, or you can encapture it in that top part where I say put like career highlights or career summary. And you can also weave it throughout the experiences as well. It never hurts to put the therapeutic areas multiple times, especially if the specific CRA job that you're applying to says oncology experience preferred, or would be great, or neurology experience, cardiology experience. If they say that they're looking for a specific TA and you have it, then definitely feel free to weave it throughout your resume multiple times. That's the best way. And then the first part of the question was, should I include therapeutic areas in my resume? Absolutely. Absolutely, without a doubt. You want to include all of your therapeutic area experience, even if, let's say, you're not coming from the clinical research space, but let's say you're coming from bench science, or you're coming from the preclinical side where you're doing like running PK tests, or let's say you're coming from the bedside and you're a nurse or pharmacy, what have you, and you have a specific TA experience or specialty population that you work with, like pediatrics or elderly, or other types of, populations, like let's say mental health, something like that, specialty areas. You always want to capture all that information because it's pertinent, it's relevant, and that is one way that you can definitely help yourself stand out. This question says, it's from Gurab. Please forgive me if I'm murdering your name, but Gurab Sarkar. How can we manage fast reviewing at site when they say increase my pace for SDV. So I think the question is asking, how can you increase your SDV pace and review faster at sites? So that's a little bit challenging question, because depending on the study that you're on, the protocol that you're on, the data that you're reviewing, sometimes the pace is just the pace and there's no quicker way. It's one of those tedious studies, for example, oncology or neurology, where you have to review a lot of medical records and there's just pages and pages, hundreds of pages of medical records. I mean, the pace is what it is. But if you're on a study where the sites create source documents specifically for the study, and essentially all you got to really do is look at the data points that are being captured in EDC and the data points that are required for the study, then that's going to be a lot quicker, a lot faster paced SDV in. So I would need to hear more about what specific studies that you're talking about, what type of data you're looking at, what's the TA. I would have to know more in order to be able to address that question. But all in all, the best way to get faster on anything is practice, number one, and then creating some type of system. And Daniel, the CRA coach, he actually has a very, very great CRA system through his course, the ASAP, I think it's called the ASAP CRA course, or the ASAP course. I'll drop that link in the comments too. But he has the CRA coach. He has a very great course on how to stay organized and craft a system that really works for you. And then another question. This is from Kara. What is some of the essential concepts? No, Cashel. Sorry, I had that intertwined. Cashel, what is one of the most essential concepts to ensure you mention in a CRA interview? So, one of the most essential concepts, I would say, going back to the gateway skills that I mentioned, you want to try to weave those in as much as you can. And when I say that, so even during they might not ask you these questions directly, right? They might not flat out ask you what's in the TMF or what's the ICF or what's the consenting process. They might not flat out ask you those questions. But if they ask you behavioral questions or situational questions, where they're asking about a time where you had a deadline that was tight, or you had competing priorities, or there was a time where you didn't understand something, what have you. Those are the times where you want to weave in all those concepts throughout the interview. So don't just depend on them to ask you the questions directly to showcase your skills. A lot of times you're going to have to weave it in indirectly, and that is really going to help you stand out and give you that edge. This is how you sell yourself, guys. So when I talk about branding, marketing, and selling yourself, this is what I mean when I say selling yourself. And it always boils down to you showing them that you can take care of that baby. If you don't remember anything else, remember that you have to prove to them, you have to be able to show them that you can take care of their baby, which is the job. And by weaving in those things, even without being prompted, and just imagine if you're interviewing somebody to take care of your kid. For those of you who maybe don't have kids, and you have a fur baby, your puppy, your cat, whatever your pet is, imagine hiring somebody to take care of your kid. And what would you be looking for? What would you want to see? What would you want to know? What would impress you if you were interviewing somebody to take care of your baby? And try to think about that analogy whenever you get lost into the details of what should I say? What are they expecting? What can I do, or how can I stand out? Try to just stick with that analogy for a little bit and ask yourself, okay, what would impress me if I was looking at a nanny or a daycare provider or whatever to take care of my kids? So think about it from that perspective. And usually that typically helps people gain some ideas as to what they're specifically looking for. But the most essential concepts would be to show them that you are an independent thinker, that you can solve problems, because a lot of the CRA work is not going to be monitoring y'all. It's going to be solving problems, because it's let's face it, you're going to be putting out a lot of fires most of the time. So if you can solve that, show that you're quick on your feet, you're a quick thinker, that you can solve problems without being handheld, that you can work independently, but also work on a team, because there's a lot of teamwork involved, but that show that you're good in both environments, as a team player, as an independent thinker, that you're critical thinker, that you pay attention to detail. That's another important skill. That you have leadership qualities. Essentially, all of these are leadership qualities. But that you're analytical, and that you can pick up on trends, because a lot of times there's repeat things that happen, and they want to be able, it's a good thing for you to be able to, a good thing for you to relay that you can pick up on these trends without somebody having to ask you to figure out the trend, or specifically point it out for you, but that you can do that on your own. I would say being organized. Those are like the main things that, shows that you can be a good CRA, outside of course, having that clinical research experience, the 10, as much experience as you can in the 10 CRA gateway skills that I always talk about. So I don't see any more questions, and I'm going to table the rest of the questions that I've previously gotten in the past. I think for the most part, I've pretty much covered most of them, if not all of them at this point. There might be a couple more that I've missed. I'll go through. But if you ask me a question in the past and I haven't addressed it yet, please don't hesitate to DM me, send it to me again, or drop it in the comments. And I know I'm so bad about going to YouTube and checking the questions that are on YouTube. So if you sent me questions on YouTube, my apologies. I'll make sure I cover those the next week. But tomorrow I'll be coming back on live at the same time, and I'm going to audit a aspiring CRA resume live. So for those of you who have all these resume questions, Kiana, you had resume questions today, so you definitely don't want to miss it. I'm going to audit a resume live, and you'll get to see exactly some of the things that I say to focus on, what not to do, what to do. You'll get to see that live. So join me tomorrow live at 7 p.m. Eastern Standard Time. And for those of you who are wondering how you can work with me, how you can, get support in your CRA journey and stop doing it on your own, I have a 6-month coaching program where I help clinical research professional women confidently land their first CRA job offer, struggle and frustration free with no monitoring experience or CRA certification, all through just teaching you BMS, how to brand, market, and sell yourself. And the program includes an initial onboarding call where we immediately, right out the gate, assess and revamp your resume, cover letter, and LinkedIn profile. You'll get 6 months of private coaching sessions with me one-on-one. You'll get immediate on-demand access to my curriculum filled with all the frameworks, templates, checklists, everything that you need to land your first CRA job. You also get direct messaging support with me so that we can communicate outside of the weekly calls. You'll get a mock interview with a recruiter. You get bonus courses on negotiating a high-paying offer, and then also fast-tracking your career once you actually land your first CRA job offer. You'll get a CRA career plan and so much more. So if you're ready to land your first CRA job and figure out how to do it with ease, with no monitoring experience, no certification, then book a sales call with me to learn all about my private coaching program and how I can help you. Just visit aspiringcra.com. So let me see. I see Kiana said thank you. And I don't see any more questions. So we're going to call it a night. If you do have any more questions, they pop up, please put them in the comments. And like I said, or DM me so I can add them for next week, or possibly address them tomorrow. I'll be back on tomorrow as well. Like I said, doing the live resume audit. But as always, thank you guys so much for joining me. It has been an absolute pleasure as always. And have a great night.